Wade. Jesperson.
Here.
McNally.
Here.
Rogers. Reese.
Here.
Jones. Wilkin. King. Espinoza.
We'll go to item 2, review for the minutes. Is there a motion and a second to approve the
So moved.
already?
Wilkin.
Yes.
Wade.
Yes.
Rogers. Reese.
Yes.
McNally.
Yes.
Jesperson.
Yes. We will go to item 3, there is a request to approve item H, and other than that, the motion to approve item 3.
Jesperson.
Yes.
McNally.
Yes.
Rogers. Wilkin.
Yes.
Reese. Wade.
Item 8, the weather, legislation, children's, hospital bills, the motion to
Yes. Abstain.
Sorry, just a sec. There we go. Jesperson.
Yes.
Jones. Oops, sorry. McNally. Rogers.
Yes.
Wade.
Yes.
Wilkin.
Item 4 is public hearing. Item 8 is review of updated.
You can go over the rig. Take that off real quick.
So now anybody want to make sure you're talking to? Yes.
Okay. What it was now.
Just make sure your attention.
Oh, there we go. Okay, we're good. Okay. Let me turn this off over here.
All right, I think everyone should be able to see the presentation now. Yep. Okay. I'll just pull this down. globally as well as nationally and then locally. So globally, 1/3 of children suffer from the effects of lead poisoning, and according to the NIH, as many as 500,000 U.S. children, which is about 2.5%, under 6 years of age, have blood lead levels that are at or above 5 micrograms per deciliter, which was the blood action level that was set by the CDC in 2012. That was later changed in 2021 to 3.5 micrograms per deciliter. Here in Douglas County, we see, last year we saw 1.78% of children that were screened having a confirmed blood lead level at or above that action level of 3.5 micrograms per deciliter. Most of these children are from minority populations, 87.6% in fact, were from our minority populations, 27.9% were Asian, 37.9% Hispanic, and 21.8% Black. So as you already know, our program is fully funded by the EPA. That funding was renewed in 2022 through a cooperative agreement, and it's a 7-year cooperative agreement. So we're now funded through September 30th, 2029, which is very stable funding for our program. Our program services include blood lead level surveillance and testing, lead risk assessments, inspections and clearances. We have the interior lead dust program, or home visits, which is basically to follow up to the soil cleanup that was done by the city and the EPA, and also lead education and outreach. Currently, we're staffed with 11 people on the team. We have 4 lead risk assessors, 3 lead program specialists, which basically are the people that case manage these cases. And then we have a community health educator and a community health worker that are responsible for community outreach and increasing awareness in the community, and then the supervisor as well as the secretary for admin. So in terms of our screening objectives, based on the CDC recommendations, children 84 months and younger should be screened on an annual basis, acknowledging that children are at the highest risk for exposure because they have those behaviors that tend to increase exposure, so hand-to-mouth behaviors, creating multiple testing avenues for families so that we can increase access to blood lead testing here in Douglas County, as well as encouraging parents and guardians to be advocates for testing because not all clinics or clinicians, in fact, do screening. This here is an overview of what we've seen in the last 25 years here in Douglas County regarding blood lead screening. As you can see, we had about a little over 5,000 children being screened back in 2000, and that has gone up. Prior to the pandemic, we had about a little over 21,000 children being screened here in Douglas County, and then that decreased, and now we're just trying to get those numbers back up. In terms of the cases that we have seen related to blood lead levels, we have seen a dramatic decline. As you can see, we had a spike in 2001 where we had the most children showing up with high blood lead levels, and that has since decreased. 10 years later, you can see those numbers went down to about 400 cases, 300 cases, and then now last year we had 298 confirmed cases of children with high blood lead levels. These are categories that we look at kind of to determine how we work in the program. And so 9.5 micrograms per deciliter and above, those are quite high lead levels, and they get the highest priority. But we don't see as many cases, thankfully. Last year we had about 40-something cases, I want to say, of children with those high lead levels. And then most of the cases are below that 9.5. We had about 81 cases that were 5 to 9.4, and then 81 or 84 cases that were 3.5 to 4.9. So most of our cases are in the lower categories, which is still concerning because we don't want children to be exposed at those low levels. You still see a lot of issues related to exposure at the lower levels. Related to sources, lead-based paint is still the #1 source of poisoning here in Douglas County. Last year, we had about 72 cases. 72% of our cases that we investigated were associated with lead-based paint, followed by spices that we've seen in our community coming in from Southeast Asia or other countries around the world, and so those affect more of our Asian populations generally. And then we have some related to soil, some other cultural products, occupational exposure, and so forth, but those are far fewer cases that we see. And in terms of who's exposed, as I mentioned before, in the first slide, we see most of our minority populations. There was a decrease when you look from last year, from 2023 to 2024. We did see a spike in our white population being exposed to lead. However, it was due to misclassification when reporting race. And so that has since been rectified, and those did go down in 2024. But by and large, it is definitely our Hispanic populations, our Black populations, and our Asian populations being affected by lead poisoning. I know this graph is a little busy. There are a couple graphs right here. On the left-hand side, this refers to the percent of population 7 years or younger that are tested for lead, and these are within our high-risk zip codes, which are east of 72nd Street. So in 6A105 and 6A107, you'll see over 100% of children being tested, and that's just because not every child is counted in the census due to some issues we do have with reporting in those populations. And so screening does appear to be quite high within those populations. They're more of our South Omaha populations. In North Omaha in 68111, where we see most of our cases of lead poisoning, we had about 68% of the children living within that zip code that are currently being tested. And we do have quite a few zip codes currently that fall short of screening, blood lead screening for children. As you can see, 68102, 68112, 68131, 68132, 68110. I would really like to see over 50% in those populations. That would be a great thing to see, and we are working really diligently to get those numbers to increase within those populations. And regarding EBLs within 2023 and 2024 related to these zip codes, the yellow bar that you can see here on this graph, that is the average percent of blood lead of children that are tested that have a blood lead level in Douglas County, and it's about 0.49%. When you look at these zip codes, 68105, 68107, 68108, 68111, you can see they're well above that county-wide average. And this is because there are so many more lead hazards present within those communities related to lead-based paint. But this, I think, is something that we all should be aware of. That's how we devise our targeted outreach to figure out who we should be talking to more within the community. But I think this is something that's very sobering to see where these zip codes fall related to the county-wide average. Yes? Oh, this one? Yes. Oh, those numbers. So this looked at the population within those zip codes that are 7 and younger, and the percentage of children within those zip codes that received a blood lead test. So our numbers for screening were above the number of children reported in the census for those two zip codes. That's why it's over 100%. So they reported, let's say, 20,000 children within that zip code, or those zip codes. And we saw 21,000 children being screened. But so not all of the children were counted in the census, because I use census data to determine the population. We're tested for lead. Yes. This one with the bar? Okay. Okay, so in this one here, these are the percent of children within the population that have a elevated blood lead level that's 3.5 micrograms per deciliter or above. Whatever the population within that zip code. Yeah, within that zip code. So these are all above even the national average. The 68105, 68107, and 68111.
So, like 110, you were at 110,
Mm-hmm.
2.5, 2.3% of the kids are testing completely
Correct.
average.
Yep. Yep.
Thank you.
No problem.
That a little further,
Oh,
that is substantially down from 2020, 2021.
um, our cases, yes, it's going to be yeah, it has definitely gone down. But then screening has also gone down. If I had put 2021 testing, 2022 testing, which would have reflected on the graph on the left, you would have seen that screening did go down within those zip codes as well. Within the Superfund site, I will say about 3,000 less children were being tested. However, I also want to say that the population, looking at the 2010 census and the 2020 census, the population of children 7 years or younger decreased as well, about 2,000. So that population decreased, or who were reporting decreased. So looking at this year in terms of blood lead screening, we've so far had close to 11,000 children being screened. We've had 205 confirmed cases, and these are both new and old cases, so our prevalent cases. We've had 109 new cases. And then, as I mentioned before, 84 of those cases were within the 3.5 to 5 category. 5 to 9.4 were 81 cases, and then 9.5 and above were 40 cases. I should also mention that in August we did have quite a few high lead levels coming across, because in August we tend to see more screening. Children are going back to school as well, and we did have one case that required chelation, unfortunately. So we responded very quickly to that one. In terms of our cases that have closed, we closed 148 prevalent cases in 2023, 124 in 2024, and then this year we've so far closed 57 cases. This is what we love to see. We love to see cases being closed. And children's blood lead levels have gone down. That means they've gone down below that 3.5 micrograms per deciliter. This is a zip code map looking at the distribution of cases. In the yellow highlighted area are those 11 zip codes that are in our high-risk communities. In the circle, 68111, 46 cases so far this year. As you can see, that is more than double the amount of cases for 68104 and 68107. And this is very much on par for what we usually see year-round. Within these zip codes. We have 170 of the 205 cases that are within our high-risk zip codes. So what are we doing to increase screenings? We've had our partnership with the WIC clinics, so the Women, Infant, and Children clinics. We've been partnering with them for a very, very long time. We partner with our federally qualified health centers, so Charles Drew, One World, Fred Leroy, to have screenings completed and ensure that there is reporting that's being taken place within those communities, as well as universities. Nebraska Methodist College, we've been partnering with them since 2016 to conduct blood lead screening in Omaha public schools and Head Starts, as well as some daycares they've done. And then Creighton, we provided them with a BloodCare 2 analyzer, which are those point-of-care instruments to do testing on site. And so they have been doing that on and off since 2023. And so they're also going to be starting up this fall to do screenings in private Catholic schools, as well as other daycares within the Omaha lead site, as well as outside, so expanding screenings. We do not pay them for screenings. We just provided them with a machine to conduct those. And then we also partnered with the University of Omaha, so UNO here in town, to do a service learning sort of project with their chemistry class, where they were able to test spices, which is our second leading cause of lead poisoning here in Douglas County. And so students in the first year chemistry class, Chem 101, or maybe it's 100, they conduct testing. They'll go to stores here locally, so local ethnic stores or big box stores, and they'll buy spices and then they'll test them. and then determine exactly what those what the results are from that. And so that's been really good citizen science learning, and they've been able to do raise a lot more awareness around the younger population regarding this. So in terms of our WIC screenings, it's basically 4 locations here in town that conduct these screenings. For the last 7 years, there have been 13,101 tests conducted. And the graph kind of shows what happened during the pandemic, how screenings went down, and now they're going back up. This past year, we've had 1,667 tests completed so far. So we're hoping that we can ramp up. I will say that we've had Charles Drew and One World, there have been some staffing issues, and so I've reported that in our monthly update to you. But it's definitely affected screenings, and so we're hoping that with more stable staffing and so forth, we can increase the number of screenings that are being done at those locations. Nebraska Methodist College, again, the graph looks at the up and downs of how screenings have been going, but they have been steadily improving since 2022. From 2016 to 2024, they've screened 6,177 children here within the Omaha-led site. This past year, they've done 198 tests, but most of their tests are completed within the fall, and so they did start back up screening in September, which is this month, and so we'll have more information in the reports later on, so next month. In terms of screening in action, you can see where most of the screenings are taking place or who are doing them. So the WIC screenings are quite high. Nebraska Methodist College second, and then Douglas County. We do blood lead screenings in our clinics on Tuesdays. We also do in-home blood lead screenings as well as at outreach events, and so we're trying to increase those numbers. These screenings that we initiate basically through our partnerships are responsible for about 21% of the total screenings conducted in a year. So 1/5 of blood lead screenings that are conducted here in Omaha are done by the county initiatives. As I mentioned earlier, the Lead Care 2 analyzers, we are funded to provide these. We have 14 of these that we can provide in a year through our funding. Between 2022 and this year, we have provided 15 analyzers to different locations in our community to increase blood lead screening, but also follow-up, because a lot of times people are waiting for those tests to come back, and it is a barrier. They might not be able to take off work to take their kids back to the doctor, and so with these, you get a result within 3 minutes, and then you can do any follow-up testing as needed after that. So recently we did purchase another 14 analyzers, so we have 13 currently in stock, and we're hoping that we can get those out again. We have we do have a UNMC MPH Apex student right now, and we're working to get these analyzers and get the word out in the community. She is a pediatrician, so her insight is really, really great for our program as well. So we're going to utilize the resources that we do have to improve this and get these out. In terms of screening of pregnant people, we do recommend that anyone that has had exposure in childhood that is now pregnant, that they get screened, because the lead that's stored in the bones can be released during pregnancy and then to that fetus. And so we're working to improve awareness with our OBGYNs here in Omaha. We have provided information, and we're trying to get people on board to do screenings and provide those analyzers. We've provided information to the Olson Center here at Nebraska Medicine for them to put our flyers in their little packets that they give out, in those folders that they give out to expecting moms. And so we are hoping that that will help to increase awareness, but we also are doing cold visits to clinics and hounding them, and hoping that we could do some more lunch and learns with them where we can engage and see exactly what those barriers are, because a lot of times it's resistance to changing what they're currently doing. They don't want to do an additional step, and so we're just trying to raise the awareness of the importance of actually doing this, because it does affect that baby that will be born, later on. And we've partnered with Essential Pregnancy Services. We did screen about 40 women this past year. So that's been a big win for us. And so we're hoping to continue that partnership and screen more people that do go to that center. In terms of lead-based paint in housing, as you know, about 96% of 96% of housing east of 72nd Street was built before 1978. We do provide free Swiffer wet jets to homes where children have a high blood lead level. And so last year we provided 152 to homes that were built before 1978 with those children. All of the homes that we find that have lead hazards during our inspections are referred to the City of Omaha's Lead Hazard Reduction program. So that's the program that's funded through HUD. And so we just refer everyone, see if they qualify, and if they don't qualify, then we try to figure out exactly how they can address those issues within the home, because it can be quite expensive. In terms of our lead risk assessments, inspections, and clearances, we completed 286 inspections last year. Of those, 72% had lead hazards present within those homes, so that was about 206 homes. This year, we've so far completed 216 inspections through August, and 63% of those had lead hazards present within the home. In terms of properties that have been cleared, last year we had 39 that were cleared, so you can see they're not quite where we wish them to be. But through the City of Omaha, we had 7 that were cleared through third-party clearances, so our rental properties and so forth, 17, and then we cleared 15 properties. So we've really been busy, as you can see, with the categories of inspections here, with our pre-1978 inspections, where a child doesn't have to have a high lead level for us to go into the home to do a visit. We did 101 of those, and then for the EBL inspections, there are the different categories, so you can see how many we did, and then how we're tracking this year as well. We did increase clearances. You can see we had 15 last year, and now we have 25. In terms of the interior lead dust program, which is the follow-up to the soil cleanup that's being done by the City of Omaha and previously the EPA, we do provide free HEPA vacuums with that program for qualifying properties. And so far, we've done over 7,400 properties or homes. We provided them with vacuums and done dust sampling as well. This program has been running since December of 2010. Our goal basically slowed down to match the city's cleanup rate. So they do about 100 properties a year that they clean up. And so our goal is 100 of these homes that we provide vacuums on an annual basis. And so far we've been pretty much on par with keeping up with that goal. Regarding our current lead ordinance, as you all probably know, we do have a lead ordinance here in Omaha that was put into place in 2012. That lead ordinance basically is people are made aware of it or even activated when we go out to do an inspection into a home and then notify the owner that maybe they have violated that ordinance. There is lead-based paint present within the home. There are hazards. They haven't been cleaned up. They need to clean them up. The ordinance gives them about 30 days to address that. We have a current draft of the ordinance that we are proposing, and it's a rough draft, but these are some things that we have put into the draft. We have mandatory lead testing for children that live east of 72nd Street, because realistically, we are not testing all children. In Douglas County alone, there are about 26% of children on an annual basis that are tested for lead. Within the Superfund site, the rates are higher, but it's not over 50% of children that are being tested. There are about 25,000 children living within the Superfund site that should be tested, and we have a little over 9,000 that are tested on an annual basis. So we really are going to strive for mandatory blood lead testing within this area, as well as mandatory access to the health department to conduct risk assessments in homes where children have elevated blood lead levels. And then we do recommend a mandatory risk questionnaire for children living west of 72nd Street, because we do not live in a bubble. Children come into these zip codes. They may be coming regularly to see a grandparent and so forth. So we want to make sure that these children are also being assessed for risk when they go to a visit. Regarding pre-1978 housing and lead-based paint, in the ordinance, we do propose a registry so we can keep track of these housing for rental properties. As well as a lead maintenance certificate, which will be renewed on an annual basis. All this is just negotiable. These are pie in the sky sort of things that we're striving for. So the lead maintenance certificate would be for properties that do have lead-based paint to ensure that they are being inspected on a regular basis, because we have seen through our investigations properties popping up multiple times with different children being poisoned after we've been into these properties. So we're trying to see, you know, what other cities are doing across the country and seeing if we can have something like that implemented here in Douglas County, in Omaha specifically. And then lead in soil, we would like for rental properties and these other properties listed here, mandatory testing and cleanup if they do exceed the cleanup standard. So daycare, schools, residential, rental properties, as well as outdoor recreational areas where children can be found at. We would like the soil to definitely clean up. Currently, per the EPA's record of decision and the residential plan that they have, all of this is voluntary for cleanup. It is not anything that's mandatory. And so for rental properties, especially in places where children frequent, we do think that it is in the best interest to have mandatory cleanup if they do qualify. Currently, it is free, so it's a plus. And then lead in water, mandatory testing in schools and daycares. I do know that Head Start, they do have mandatory testing for water that was implemented recently, but we would like this to be mandatory for schools and daycares. In terms of addressing lead in spices and consumer products, oh, sorry, yes, I can go back.
So you mentioned the mandatory testing is done at a daycare or school residential property. That the remediation is free because that is still paid for under
The cooperative agreement, yeah, with the EPA.
EPA,
Correct.
And then do you have any interaction with MUDs given the major effort underway to replace lead service lines to 16,000 homes in the zip code?
Yes, we do. We refer, so when we go to properties, we do look on the map that MUD has made public to see if that property has a leaded service line or not. We then will make the owner aware when we go out to say, hey, we don't know if your water has been tested. And we will refer that property to MUD for testing and for follow-up. They also provide a water pitcher to those homes, and those properties will also be put on a higher priority that we refer for replacement of those service lines.
And I believe those service lines that's also funded.
Yes, correct. There is funding. There was state funding that was put in place by the state legislation to address that. And I think MUD also matches some of it. All right, regarding spices and consumer products, we have received funding. Dr. Hughes had applied for a grant through Sherwood, and we did receive funding to purchase a new XRF, so that's our X-ray fluorescence. Kind of looks like a space gun that we use to do testing for paint, and this one will have the capability to test spices, which will increase our ability to provide that information to the public. So we'll be using this at outreach events. People can even later on, we will announce they can bring their spices to the health department. We can test them by appointment and provide those results to them. And this also will help to open up testing when we go out for cases as well. We do have limited funding regarding lab testing that is now being done by the Nebraska Department of Agri-Lab. We have $10,000 set aside for testing. However, it is very expensive to conduct a test. To test one sample. And so it's about $40 a sample to get tested. And so this will help to expand our testing in addition to those funds that we do have. We are working with the state on a repository to make results public from the testing, and these will be lab results that we have had conducted through whatever certified lab that we're using at the time. And so the state also is working on nationwide to have a repository that will be something where the general public can go on and they can find those results. I do want to mention that between 2018 and 2024, we've tested 1,456 samples, and 620, which is about 42.6% of those samples, have tested above 100 parts per billion. That's what our recommended limit is for lead in food or consumer products related to if you're consuming it. Currently, there is no standard set nationwide, and so that's what we've been using because it's the standard that they currently have for lead in candy. In terms of our outreach objectives, we basically want to increase awareness, increase our screening numbers, increase number of inspections, interior lead dust visits, as well as collaborations within the community to increase awareness and generally make sure people know what's going on with lead within our community and what the health department services are. So we do have an annual advertising campaign that's been running. We currently have a contractor that we use who's a local company, so they're very much embedded within the community. They understand our community. And so you've probably seen billboards around our community with the black and yellow signs, the lead poisoning in children under 7 is scary, as well as on social media and TV ads. We do have ads on Telemundo. We sent out direct mailers to homes. So we're trying different avenues to try to reach people. Social media has been very effective with getting people to go to the website, which is the fightled.org website. We have a form on there that you can see on the bottom right-hand corner of the screen that people can fill out to request more information. But our social media campaign has been going well in terms of we did a podcast with the Sky One, which is in North Omaha, and we then took little clips and snippets and we posted it on social media with ads basically. One of our ads had over 56,000 views, which is great for any health department. So we know that the word is getting out there, and our websites had about 22,000 impressions. So people are visiting it. So we're hoping that next year we'll see improved screenings when we look back at this year. In terms of our outreach numbers, in-person outreach, as you know, due to the pandemic had decreased. And so now our numbers are going up. Last year, we had close to 26,000 people that were reached through community events. This year, we've reached about 10,013 people at 108 events within the community. And we do have, as you can see, a list of languages that we provide information to members of our community here. So outreach is robust. With our community health worker and our community health educator, they are constantly busy. We have breakfast and learns, which basically are the events that we go to in the mornings at Head Start or OPS elementary schools. And we provide like a little fruits and some edibles to parents, and then engage them in conversation while they're dropping off their children as well. And so this month has been very, very busy for our team with those events. We also do survey our program to see exactly how we're doing. We conduct surveys. Last year we did 257 surveys. These surveys include confidence questions as well as knowledge-based questions, and you can see here how people did. On average, there was an 88.27% of people that took these, and that was the score that they received. We also asked them, how satisfied are you with our program? Is there anything that we need to change? Our satisfaction score is currently 98.74% per our results from last year. That has definitely improved. We implemented this survey back in 2018, and our satisfaction scores have gone up 3%, which is a good sign. But we do change our questions in that survey and adjust them based on the feedback that we get from those surveys that we conduct. And that's it. I did also want to mention something that I did forget regarding the ordinance. We are going to be working on a survey to determine exactly community awareness about lead poisoning, as well as the buy-in for changing this ordinance and then making strategic changes to the draft that we have based on those results. So we're hoping we have something by December that we can roll out and see exactly what the community engagement is, what the politics looks like, and so forth for getting something like this passed. Okay, so Sure. So Flatwater Free Press had reached out to us last year and kind of made us aware that they were interested in looking at lead poisoning in Douglas County and the legacy that we've had here. They did receive some funding from a national publication. And so they have been providing test kits for soil, to test soil within the community to see exactly what those lead levels are after cleanup has been conducted at a property. And so currently it's ongoing. They're still doing that testing to see what those lead levels could be within the community. They've reached out to us at the health department regarding the health side of of the Superfund site regarding our recommendations regarding soil lead levels. If they don't qualify for cleanup, what those lead level, what do we tell people within the community? And so we've just been, and we have provided them with aggregate information. So that chart basically that you've seen with screening numbers and our EBLs over the last 25 years, that information has been provided to them. So aggregate numbers for on an annual basis, up until last year, have been provided with them. So they're looking for background information basically regarding what the health department has done to address lead poisoning and raise awareness here in Omaha. They've reached out to the city of Omaha as well regarding the soil cleanup and their involvement with that, as well as the EPA, that were responsible for soil cleanup up until 2015. They're looking, I think, at the efficacy of the cleanup.
So, it's just a broad, I don't know what this, goes back to any questions?
Yes. Hi.
I have two things. Number one, I'm curious, correct me, but mandatory testing is required by healthcare professionals for children on Medicaid at age 12 through 24 months, and then again between ages 2 and 7.
Correct, yes.
So required.
Yes.
So, what is the mechanism for looking at accountability by healthcare professionals to do the blood level screening when these children come in for routine immunizations? How does the public know the accountability in terms of healthcare professionals following up with doing that required screening?
I think that's a little bit of a gray area, and I know that we've broached this with the state, and they are currently working with Medicaid to figure out exactly what the follow through is by providers. However, I'm not sure what those repercussions are if they do not do it, the test.
So then, following up on that, in your report, you indicated your staff at Charles Street and One World, that's translating into life screening.
Correct.
So could one safely assume that if a child comes into, for instance, Charles Street for a 12-month immunization, because they are low staff, they might not get the blood level?
Yes, and what I'm referring to with this data for Charles Drew, it's their WIC clinics that we coordinate with to do the screening. So they've been short staff in the WIC clinic.
So, well, I'm gonna talk to you individually.
Okay. Okay.
Because this has been one of my passions and
Yes.
research that I did years ago, is that missed opportunities for something that's entirely preventable
Yes.
by healthcare professionals.
Yeah. And I will say on the other end that there has been a lot of interest in the Omaha lead site. We had been contacted by, there were a couple universities that were basically coordinating to do a study here on the lead site to see exactly what test scores are looking like for children that are in the that live within that area over the last 20 years. What exactly are those trends? If they've improved over time, because with lead poisoning, when you implement a change, you don't see the effect until 20 years down the road when that child's grown up, and how well they do in school and so forth, and how their life turns out. But there has been interest in doing that, and so we did refer the two researchers to the state for data, because they were looking for educational test scores. So it'll be good to just get everything from one place. But yes, there is a lot of interest in looking at educational outcomes in the Superfund site. Mhm.
I guess to follow up on your last point, do you consider maybe with the lead ordinance,
So, I don't know if the mic's hot. Usually talk or it's.
Mind saying something about,
So,
might
It's
want to follow up with those
Okay.
guys too.
So yeah, something to consider, with the lead ordinance would be like any student on the IEP to mandate that they have a lead weapon in the last year of their under seven. Something to consider there.
that would be yes, that
And
would be
then,
definitely good.
definitely as far as the healthcare professionals, it is an ongoing issue. And so particularly in these high-risk zones, I'm recommending lead assisted PM1 if the agitating rate in the area, like just to do some outreach to clinics in those areas in particular.
And we do that. So with our program, we do have targeted outreach. We are out in the communities. We are canvassing those clinics. We're trying to get those machines out so that if you have a barrier to testing, you don't have the lab capability to, send a sample to get tested, that these machines are available. And so we have been actively reaching out to those clinics, conducting those cold visits to see exactly if we can get in there and have them conduct these screenings that are very much needed within those communities.
And then, yeah, any outreach, I guess, like Walmart or the grocery store.
Yes.
Give them a warm, like, to set up shop there on Saturdays and I don't know, some kind of things.
Yeah, if you have more ideas, you send them our way. We try to brainstorm them, come up with new and creative ways, things that maybe we haven't done in the past that we can get to people because our population for parents are changing. They're younger parents. They're not doing the traditional things that they usually do, that we've seen in the past. And so we have to adapt to meet those needs as well. But thank you.
Yeah, another thought I had was the neighborhood cleanup cafes. Sometimes you're waiting in the line and so maybe that's the opportunity to come out there to maybe set up shop to offer.
And we have changed our scheduling as well. So we do have someone that's now on staff. She was on maternity leave. She's back now. But she can do lead screenings on Saturday. So, yeah, we're trying to expand.
Just one follow-up to that, so that was pleased to hear your comments about the outreach. I think that's important for the St. Regis Soccer Jungle Society. But then also, maybe as a test case, shout out to Adam who's in the audience and the food ordinance that came through the city council, which was not easy to get passed.
Mhm.
But I think the key portion of getting that passed was all of the outreach they did previously with interest groups and stakeholders, and in this case, families and kids in public schools, before it comes to the city council. So
Yes.
that was an important aspect of getting that done. And I think that'd be important here too. It sounds like you're going to do that before the end of the year. So
Yes, I think there'll definitely be some hurdles that we'll need to get over, especially addressing lead hazards is very expensive. Other cities have come up with foundations that they have like a lead foundation where philanthropic donations have been made, and I think Cleveland had over $100 million in theirs. And so, if we can have something like that here in Omaha, that we can be able to provide no interest loans or some sort of subsidy to owners to get hazards remediated in the home, I think that will definitely help with getting something like this passed. We're coming up with these strict, stronger things, ordinances, but how are we really realistically going to have them addressed? But a foundation, I think, would be something that is really good to explore as well. Yes.
Sorry, I'm gonna redirect back to the spices.
Yes.
You said there's no standard on like the spices.
Correct.
So that's not gonna help.
Yes.
So it may be a moot point, but are we going back and seeing if they're self-employed or if they're doing appropriate grocery stores?
We do collect that information when we go out. And so we've actually partnered with Adam's group to provide information to our local ethnic stores as well.
Is that a trend that we see more and more imported hazardous?
Majority of them that we come across with the higher lead levels are from ones that are brought into the country by whoever's consuming it, by the resident. Exactly, self-imported. And then the other ones we do see, they're being imported. We had one case where it was 680 something parts per million. It was quite very high. And so that was a product that was purchased here in town locally. And so that's why it's so important to partner with our food inspectors that are going out to do education and inspections. Because, oh, go ahead.
Are grocers, restaurants, are they cooperative with it? I mean, what is it once you point this out? Because if there's no standards, you can't force them to take that.
Correct. You can't force them. There is no standard. You can't force them to take anything off the shelf. If they're in a different language and they're not in English, then we can have them pulled from the shelves. Correct, Adam? Yes. So, so some of them that we've come across, they've been in some different languages, and I know that stores do pull them once the inspector goes out to, if they come across them. But it's not, you don't know if it could go back up. Online vendors. So we've seen recalls from Amazon. Lately, there was one regarding a aluminum pot that is used by a lot of our immigrant populations, our Asian populations, that did have lead in it. It wasn't painted; it was just in the actual composition of the metal, and there was a recall for it. The FDA was made aware of it, and there was a recall regarding it. So there is a push. There's a national push to have stricter, stronger standards. We have met with the FDA. Last year, I had a conversation with them regarding what their move was going to be to set a standard, because this is a national problem. It's not just something here in Omaha. And so back then, they were trying to see if they can work through some sort of way to set a standard across the board. It's easier, I think, for things like cookware, but not so much spices, because consumption, you don't know what it is. There is an amount of lead that the human body can consume, but you can't really determine that because you don't know what the level is in the spices. And most recently, we've had issues with cinnamon being imported into the country. I don't know if you guys have seen all the cinnamon stuff with in baby food that was recalled a couple of years ago. And just yesterday, I got a notification that more cinnamon was being recalled. This was in New York, that was being imported into the country. And so it's a big discussion to have, and I'm not sure how we're going to address it, but I think there needs to be some sort of a standard and accountability on the part of the manufacturer and distributor, because it is coming into our communities. And it's kind of hard to regulate, especially if people are bringing it into the country. We do partner a lot with our minority serving organizations to provide information to them to ensure that they are aware of it and they're sharing that information. Restoring Dignity is one of those organizations that did home visits, and so they have this little packet that they do with slides, and we provided them information, as well as our spice brochure that we do have translated into 9 different languages so that the community is aware. But we're still looking to see who else we can reach out to, because we just discussed this in our staff meeting regarding the cookware that was found and recalled recently, to how we can get that information out to the people that are actually being affected by it. Yes, I think once they go out and they come across anything that is like that, yes. But we will be looking to see what we can do here locally. I'm not sure what we can do. I know there are places like New York that do have local guidance regarding products that are coming into the ports and what they do with it, like ceramic dishes. If they test high for lead, they'll puncture holes in them so that people can't cook in them. So there are things that are being done in other states. Yeah. Yes.
How, you know, how quickly some of the things that are about like how quickly did that start showing up at
It could be immediately. It could be this child, like we've seen recently with our chelation case, they consumed lead-based, like paint chips. The child ate the chips. It got into the body, and then it's absorbed really quickly.
does that level come back down after you in that environment, or does it take a while, or is there certain things that have to be done to get that out of the system?
So nutrition is a very is something that we talk a lot about, proper nutrition, but the half-life of lead, so to get rid of half of the lead amount, let's say a child has a 28 microgram per deciliter level. To get to 14, it takes 28 days. So every every 28 days, then that level will go down by half. Um, that's what we typically see. I did want to tell you guys a little entertaining story that happened recently. So we had gotten a call from the state about a family that had been exposed to lead. They were power washing their house like people tend to do before they paint here. And lead chips had gotten into the yard. They have chickens. The chickens ate the paint chips and they laid eggs. And then the eggs were tested and they tested high for lead. So they couldn't consume that. They were exposed to lead. There weren't any children that were under 7 years old. So the state did address that case. But I thought it was very interesting and a cautionary tale for us here in Omaha that power washing, getting that paint out into the soil, not cleaning it up, and then if you have animals, they can ingest it. And if you consume those products, like the chicken eggs, exposure does occur as well.
Nadia, I'm just trying to think back way back. So 20 years ago, when you gave the chief the evaluation and set up, they committed to the yard remediation and things like that. Now that position is all about. So it's
They do repaint houses. On the exterior of the house, they will repaint it. So if the yard qualifies and they test the outside, they will repaint the outside.
so with this case you gave, the example that you just gave, this one this house. This house probably didn't show up on the radar because they didn't have kids in the house or something.
I'm not sure why it didn't show up. It didn't seem like it was an issue related to where the soil had tested high previously. It was more it was just an older house that was on a property. And they were looking to repaint it, so they power washed it. But during the summer months, we do have a lot of complaints regarding this, and we do go out to address them and address cleanup because, I mean, exposure is just one little chip that a child gets in their mouth, and then they become exposed that way. So you can have an acute exposure. But most of our cases that we do see are chronic exposure, children living within these homes. And so those lead levels generally take a little longer to go down because, again, to address lead hazards, lead-based paint in a home, it's very expensive. We only have limited resources available within our community to address it.
Do you know how long ago was the ordinance redone that you're doing? Was it redone back in '01 and '02 or did you even know that might that play this is the first time it's about?
I know it was passed in 2012.
Okay. So this is 10 years.
Yeah, 15-ish, yeah. 13 years, yeah.
Do you don't feel any threat on everything that's been going on in the environment with the EPA contract?
No, I don't think so. They did review it initially when the administration changed, but we didn't have anything that really did change. Recently, we'd asked if we could purchase our XRFs that we use to test the paint in the homes because we generally had rented those for a long time. They have approved that we can purchase two of those, and so in addition with the one that we were able to get with the Sherwood Foundation, it definitely has helped with that. So, yeah, but we haven't had any issues regarding funding or changes.
One last
Yes.
thought. Given the potential impending change in this country regarding immunization for everybody, including children, and unfortunately, Americans not getting their children immunized. I think we need to keep this in mind to make this level of testing even more important because it's possible there'll be fewer children coming in for what used to be required immunizations. And so once again, that opportunity will be missed for something else.
That's a very valid point. And I mean, you can see after the pandemic what happened with screenings. People weren't going back to the doctor as they were prior to the pandemic. So yes, that I do expect that to affect our numbers. All right, thank you.
And Bob? So I think Dr. Eve, that might maybe do it, so you might.
I will repeat your
Yeah.
question.
No, you're good.
Flexibility is our friend. All right, good morning, board. A few updates for you today. Just a few communicable disease updates for you to get us started. Wanted to let you know that we have had our first couple of cases of human West Nile virus identified. No deaths at this time related to that, but we have had a couple of people who have tested positive for that. That is not abnormal for this time of year, so typically we start to see those diagnoses kind of coming in late summer, early fall, and so that's not necessarily a big surprise. Hopefully our numbers remain low in terms of those coming in. There is an Ebola outbreak that is happening in the Dominican Republic that is not correct. It is not in the Dominican Republic. It is in the Congo right now. It is in a fairly isolated area there, so we're not going to see issues so much with lots of travel in and out of that area. However, there is, of course, always the possibility of doctors and other providers who are going into that area to provide care, who could potentially have exposures, and those individuals could be brought back to specific places such as Omaha with the biocontainment unit. So we're just keeping our eye on that. There's nothing at this time that's impending, but I did want to let you know that it's out there and we are watching it, and if needed, we'll start to parallel our public health response along with the biocontainment unit at UNMC. Also, just a quick note that yesterday there was a press release that came out from DHHS. There has been a case of H5N1 flu identified in a dairy cow. That is in central Nebraska. I don't have any specifics for you in terms of even what county that is. We just know that it's in central Nebraska. There is no human illness associated with this at this time that we are aware of. That's always something that we're watching for, especially in those who are caring for or handling those cattle. At this time, they believe that the risk remains fairly low to the general public, but did want to make sure that that is on your radar as it is on ours as well. So we'll continue to watch for any developments of that. And I'm sorry, I don't have any more details. That's basically the content of the press release that we received yesterday on that. A couple of other quick updates for you. Tomorrow and Friday are going to be big days in public health. So the newly reformed or reappointed ACIP committee will be meeting. This is the independent committee that works with CDC to make recommendations around vaccinations for people, especially for children. So tomorrow and Friday, like I said, those meetings will be ongoing. What we know at this time is that COVID vaccination, MMR, and Hep B for children are going to be on that agenda. We'll be watching that information very, very closely. We expect a fair amount of debate to happen around that. And so we do have people who will be watching that, listening to that in real time and kind of monitoring that situation, and we'll basically watch and see what recommendations end up coming out of that. So what happens from there is ACIP makes their recommendation to the CDC. The CDC then generally accepts the recommendation or rejects their recommendation, and that information is used by a number of agencies, organizations, and companies around the nation, especially insurance companies, to decide whether or not they're going to be covering vaccines based on those recommendations. So there are pretty far-reaching implications from the outcome of these meetings, so I will keep you updated. I do recommend, if you have the bandwidth, to maybe check in on those conversations. It should be an interesting couple of days, we can say that. We are having internal conversations around what we might do if those recommendations change. One of the concerns I have is that if let's say the hepatitis B vaccine and the MMR are no longer recommended, or if those recommendations change significantly from what they are now, it could impact how we receive vaccines for children. Talking about the program Vaccines for Children, so VFC, a number of our hospital systems and providers around the community are VFC providers. We also are VFC providers. And so we are having some internal conversations about how we might handle those changes and recommendations, and perhaps a different coverage or different availability from those federal programs, and how we can assure that especially those who are at highest risk and have the least ability to seek out vaccines can still get those for their kiddos. So there's still a lot to come. There's a lot that we don't know yet, but we are having those conversations ahead of time so that we can hopefully plan for how we can best care for the public with that. Some more internal events, and Mr. Festerson, before he had to leave, did mention this. So Chapter 11 of the Omaha Municipal Code, which is basically the food code, has undergone quite significant revisions. And after a lot of work on the part of Adam Carlson and his team in food safety, we're able to really collaborate really well with our community and impacted partners, including restaurants, the hospitality industry here in town. They were able to get that code passed. So we're very, very happy to have that updated. It's been a very, very long time since the food code has been updated. One of the most significant changes there is around requiring food handlers training for people who are handling food. And of course, that comes with some fees. And we have actually, under the guidance of City Council and working with them, we did opt to waive the fee for that for people under the age of 18. So we know that we have a number of teens who this is their first job, working in a restaurant or food service. And so we want to ensure that that remains accessible for them. So we did do that under the recommendation of our City Council, and it passed 5-2. So we were very excited about that. And I just have to also add my shout out to Mr. Festerson's for our food safety team and all of the very hard work that they put in on that. And I also want to give a shout out to our legal team at the county attorney's office, and also to Tim Dolan at the city attorney's office, and all of the very hard work that they put into getting this moved through. It was quite the effort. I wanted to point out to you, and this will be in your report along with all of your division reports that you get every month. There's actually a strategic plan update in there for you this time around. I was going to pop this up on the screen for you, but unfortunately, my computer has decided that the battery is going to die on me. So I did not bring that up here for you to see it die mid-presentation. But there is, along with all of your reports, you're going to see strategic priorities and projects update for September 2025. You're going to see a whole bunch of pie charts. And this is actually a report that's coming directly out of our new system for performance management that we've stood up called Achieve It. And we're really excited about that system because it's going to make it much, much more feasible for us to not only track our performance management objectives and goals and things like that across all of our programs. It's going to make it much easier for me to report our standing and how we're doing on things to you, especially around our strategic plan. So you'll see in there that we've completed 3 of our strategic projects already, which is wonderful. We have 10 of them that are progressing pretty well. We've got, again, those 3 that are completed. We have a couple on hold pending some other things that need to happen before we can move forward on those. And we have a few that are not started. And I wanted to just address that with you really quickly. That doesn't mean that they're not on our radar. We're looking at a 3-year strategic plan. So you're looking, when it says not started, those are just items that are planned but haven't actually started yet. So you'll get more information on those when we get to the time to work on those particular those particular priorities. So I just wanted to point that out to you. It's going to line out for you basically project status by those 6 priorities that we have around data solutions, having data-driven solutions, community engagement, making sure that we're developing a healthy and vibrant culture, that we're seeking out innovative ways to keep ourselves funded, that we are improving workspaces, and then policy improvement. And so you'll also see when you do go to those, there's actually a list of the active projects. So if you have questions about the pie charts and what that means, you just got to keep looking down, and you'll see a list of all of those projects and the status and who they're assigned to and all of those things. And always happy to answer any questions that you have about that, but wanted to make sure that you noted that that was attached to your reports this month, and give you some time, just a little bit of context around them, and then give you some time to look through those. And again, happy to answer anything you have. We also, next month, will be starting some community health improvement plan listening sessions. So we have chosen some priorities based on a number of different data points. The priorities that we have chosen around that haven't been released as, from the Regional Health Council yet, but I can tell you it's going to look probably fairly similar to what you've seen in the past. However, we expanded. So the last couple of community health assessments and improvement plans, we've had one overarching priority. We actually have decided this time around to break that down into 3 different areas. So you're still going to see mental health as a major primary priority for our Regional Health Council and for our community to work toward. You're also going to see social determinants of health pop up there, and that will be narrowed down. That's a really, really big topic. And then also access to health care. So we're doing a few more. I'll bring you some more updates, but I wanted to put it on your radar now that we will be having some listening sessions. Here in Douglas County, we're planning 4 of those, and then we are also doing a Facebook Live this time around. I don't even know what that's like, and I am so glad that I have a communications supervisor now who can walk me through what that's like. I've never done a Facebook Live, but we're going to do one to expand access to our community, to give us feedback on that community health improvement plan process. So look for that coming out very, very soon. Let's see what I haven't hit yet. Oh, annual report. So we have gone a number of years without publishing an annual report, surprisingly, and I'm about a week out from having that complete, having a draft complete. I would then like to email it to you for your feedback, if that's okay with you, and then to bring it to you in October for approval for us to go ahead and publish that. But it's been since before COVID that we actually prepared one and published. So we want to make sure that in all transparency, we're getting that annual report information out to the public. And I think that's it. Happy to take any questions you have. Mm-hmm. Definitely. Yes.
The report says there's always increases, but I'm curious overall what you might have any concerns.
So the question was, do we have any concerns around vaccination with school starting up, we do. So this is not a concern that is special to Douglas County. This is really something that all of us in public health and in the healthcare field are feeling across the nation right now. We are seeing our immunization rates drop. And so, you know, the lower those rates get, the less ability we have to cast a protective net over our entire population. So that herd immunity that many people rely on. So you have babies that are too young to become vaccinated. You have people who have immunocompromised systems who aren't able to become vaccinated or who their immunity just isn't good. We really rely heavily on that herd immunity to keep everyone safe. And so we definitely do have some concerns as we're seeing those vaccination rates drop. We also have a data problem. I'm going to just put that out there. So we do not have a great way to accurately gather vaccine data for Douglas County. So we do not get exact numbers of who's been vaccinated or what those childhood vaccination rates look like. We can get estimates basically by pulling, we can request numbers out from the state, from the NESA system. We have to put in a public records request in order to get that out and can take some time. We also get a report annually from our school systems. That report is collated by DHHS, and we do get that annually that basically says what the vaccine rates are in different school systems, but not all the school systems are not required to report that, and so it typically is incomplete. We usually have some school systems who haven't provided that data. So again, we do not have great data to tell us what our vaccination rates actually look like here. We're just kind of using the best data that we do have available, but we do know that across the country, those vaccination rates are dropping. So when you hear about the very high number of measles cases that we have this year, that is likely due to those lower vaccination rates in those communities. And sometimes those are closed communities, sometimes they're not. So we definitely have seen things like that increasing, and if something such as measles is rearing its head in the community, then we certainly worry about all of those other vaccine preventable diseases as well. We've had a couple of rough years with pertussis, so that also is something that we're seeing increases of kind of over time. We're seeing more pertussis than we used to in the past. That used to be kind of a special occasion sort of a thing where we didn't see it, except for maybe a couple of cases here and there. And now we have outbreaks of pertussis that are happening. And we have seen those rates go up since school has been back in session. So we are definitely seeing pertussis cases here in the metro as well. So do we have concerns around immunizations? Absolutely. This is one of the reasons we're keeping such a close eye on the recommendations that may be coming out in the next couple of days from ACIP, because again, that has a lot of ramifications for how we're able to assure that people don't end up getting life-threatening vaccine preventable diseases.
So you said the schools are not required to report to the state.
Correct. We have to do a public records request. So essentially, anytime we want data, we basically have to go through, and we're going through this with other things as well, where basically we have to put in a public records request. We can note on there that, hey, this is for a local health department. This is not, necessarily the public asking for something or a reporter asking for something. This is a local health department, which basically can expedite that process a little bit, but it can take quite some time for us to actually get data back through that process. Can they say no to a local health department? They can. Typically, things like immunizations, they'll ask us what the purpose is for our request. They haven't said no to us yet, but they do ask, what are you going to do with this data? So in full transparency, there is quite a process. There is a fair amount of red tape that we have to go through to get data.
So I thought we had, okay, I always thought we had our own data capability. So you're saying the schools are not reporting, so what is the process that we are estimating?
So
what's the process we are estimating that?
What is the process that we are how we are estimating vaccination rates? Because we do not directly collect that data. We do not have a surveillance system. So, things that are reportable or that the state collects, those are reports that are made directly to the state. They are not made to us. And so that is why we have to request it. But typically what we do is we request that data, and we go through that process of, and it's an email. It's not usually, in terms of paperwork, there's not a ton of paperwork, but we do typically send an email to them and say, hey, we need this data. Here's why we're asking for it. So usually it's for surveillance or for, our own local decision making in public health. And then we send that in. We note that, hey, this is a health department making the request, and then we wait until that data is returned to us or sent to us. I shouldn't say returned since it's not ours, but it's sent to us, and then we are able to basically look at that data to see where we're sitting. So our immunization team and Leah Casanave is the chief of the section of the division that's over our immunization program, and she does have an epidemiology background. So we'll sit down and we'll look at that and say, okay, is there somewhere that we need to do improved outreach? Is there, a population that we're more worried about? So typically those are the kinds of things that we're doing with that immunization data. But because it isn't perfect data, unfortunately, we can't always make the most expedient decisions with it, if we're only getting it once a year. But yeah, that's how we're doing it. So my understanding in the reports that they've sent us is that they're not required to report it. And I will just preface that with that's a bit of an assumption because we do get those reports with some school information missing. So that's a really good question. So Dr. McNally asked if we've worked with physician groups around town to get that data. So oftentimes they are reporting into Nessus. So that's the big state immunization reporting system. But it's not required for physicians or providers to report immunizations. So not everybody completes that information. And we can get it if we go through the state to ask for it. But that is one challenge that we have. It's incomplete data because it's not a requirement for providers. Oh, sure. Yes. Yes. Yep. Yes, and that's a yes. So Dr. McNally asked if basically going straight to our local health systems might speed that process up, I think is what I'm hearing. And so that is certainly something that we could do. And in fact, with our expanded regional health council, so now we have representatives from each of our health systems and our FQHCs that sit on that council, and we do meet on a regular basis. That is perhaps an environment in which we can have these discussions about getting better data, at least locally.
Okay. So I just want to make sure. At one point, did I hear, I thought I heard somebody in the department say we had something before all this started happening, pretty high vaccination.
Mm-hmm. Yeah. Yeah, so for those online, Mr. Rogers asked if we had reported some time ago that we have pretty high vaccination rates here in the metro, and the answer to that was yes. We, at least with the data that we had, the vaccination rates looked pretty good.
Okay, see no further questions. There is next week's scheduled for October 15th. Let me say to the board, I mentioned to you last meeting, just for evaluation purposes, if you have any errors, just send me due. I've got it in one person, so if I don't get the errors in front of me, just know. So, with that, is there a motion to adjourn? By March, second, by another, roll call.
Wade, McNally,
Yes.
King, Festerson, Jones, Rogers, Espinoza, Wilkin,